What happens when food isn't your coping mechanism anymore, but you still need something? Lou is 17 years post op, and what she shares about addiction, identity, and maintenance is something we don't talk about enough.
They give you the tool. Your stomach's small, but they don't take away your mind. That those cravings that you have, that the addiction that you had to food, it doesn't go away in your mind.
Because the truth is, the struggle doesn't end, it just shifts.
Welcome back to Bariatric Paths, where we have real conversations about weight loss, the bariatric journey, and the mindset shifts that come with it. If you're new here, I'm Jatoya, and this space is for people navigating any weight loss journey in real life. Let's get into today's episode.
All right, guys. So you lose the weight, but what happens next? Lou is 17 years post-op after gastric bypass, and she's lost 130 pounds, but still battles with food grief, loose skin, and body image shifts. This isn't a before and after fairy tale. Now we're going to jump in with the raw emotional truth of long-term weight loss. And she's here to tell us all about it. So welcome, Lou.
Thank you. Thank you so much for having me.
I'm very excited because I am getting ready to come up with my 2-year anniversary. And so I'm just now starting the maintenance phase. And it's scary because I feel like this is harder than the actual weight loss phase of like, losing the weight was easy, but now trying to have that maintain phase is very overwhelming. So I'm really excited to hear your point of view about it.
Yeah, maintaining, it's very hard. I remember back in 2007 when I first got it. It was the best thing I've ever done to myself. I never thought I would lose weight so fast after trying anything and everything my whole life, and just doing that. That was the best decision I've ever made for myself. I wish I would have done it earlier, but I'm glad I did it the time I did. And I'm healthy, I'm happy. After that year, it was just honeymoons, rainbows, and butterflies, losing that weight. And I was just like, oh my God, I'm this small.
Yeah.
Picture side here, side there. And I just, I've lost about 100 pounds, almost 100 pounds, and I just stuck there. And I didn't get to my goal weight. I don't know, but from my experiences on talking to other people, I feel like the most they lose is 100. Some is 120, but it depends on how big they are. But you can have that that plateau, what is it called when you're stuck in your body weight, that stall, you can have that stall. So
yeah,
stall. And I was like, do I have to go back to these diets? And I didn't know what to do. And my maintenance was just exercising. My eating habits were still there. I felt like I could still eat anything. It was just small portions. But then I've noticed that I started going back to my old eating habits and I started gaining weight. So, that just immediately scared me. So I went back to dieting again. Even though I've had a weight loss surgery, I still was battling like as if I didn't have a small stomach, because I believe that your stomach does stretch a little bit and you're able to eat more and with not fixing your mindset, they don't take away your mind, that those cravings that you have in your mind, that the addiction that you had to food, whether you ate food because I was sad, or because you're happy, or because you're, that doesn't go away in your mind. Your stomach, they give you the tool. Your stomach's small, but your mind. So, binge eating was part of my things. I always, binge eat and ate till I got full. For whatever reason, it made me feel good and made me feel like, okay, now I can rest and be myself, which was so unhealthy for me throughout my whole life.
Do you feel that you've ever reached a point where you're like, I did it, I've maintained it? Because 17 years, that's a huge milestone. So do you feel like you're finally like, okay, we did it? Or are you always constantly checking yourself?
Now I feel like, just recently, maybe like a week or two, I feel like, I think I'm here of where I'm at, after having my weight. The main thing that did it, because like when I had my weight loss surgery, I was so scared to have skin removal, plastic surgery to remove my skin. I was so scared. And the fact that I just did it, I'm 5 months out, and just looking at my body from there to now, now I feel like, okay, more accomplished. I could see the results. I could see it before. Yeah, I could see it, but more with pictures. I used to wear, fajas, girls to like pack it in and stuff. And I was okay with that because I was like, there's no way I'm going under the needle. I'm so scared. I'm devastated to like get cut open and all. I was devastated. I wish I would have done it sooner.
I'm very scared.
But whatever, it happened. So happy that I did because it wasn't as bad as I thought.
Really?
It wasn't at all. I mean, the recovery is hard. You really got to prepare yourself, but it wasn't as bad. I'll do it again and I'm ready for the next. Maybe not right now, but I'm ready for, some other procedures that I do want to go through in the future.
So what did you get done?
I had a tummy tuck. I had a fleur-de-lis tummy tuck and lipo and BBL. So, they have, it depends.
You got a BBL too, girl.
Yeah, well, it came inclusive with the package, I just wanted to, and I seen on the paperwork, they were like, tummy tuck, BBL and lipo. I'm like, wait a minute. I called doctor. I'm like, I think you guys messed up on the paperwork. I didn't ask BBL. Like, I was like, oh my God, I got so scared. I was like, oh my God, they're putting more stuff in there. Like,
they're going to charge me extra.
And they're like, oh, it's extra. It comes with, and I see why it comes with it because he contours your body. Sometimes they have to do lipo to contour your body. And it's a skinny BBL. It's more like a butt lift because you want it to match your body. So it makes sense. So they lift up your butt so it matches. So your butt is not saggy as well as, your stomach. So that's a great feeling.
I wanted to transfer to my boobs. I needed more of my boobs than my butt.
They do a breast augmentation for that. I don't know if they could, but they do breast augmentation.
We'll look into it.
Yeah.
So you waited 17 years after your surgery to do the skin removal. Was it 100% just being nervous, or did you want to hit that goal weight before you really thought about it?
Hit my goal weight, but it was just 100% like yes, because I was like, I'm at my goal weight, and if I remove the skin, it'll be like, I think, extra 10 pounds. And once I get there, I'm going to be able to see and know, like, this is it. Because sometimes I get so concentrated on the scale. That's not good, because sometimes it's about how you feel and how you look, and mainly how you feel, your health. Your health is more important than the looks. And looks, are great, but I believe, like, your health is really important, with all these diseases like diabetes, sleep apnea and all those things that causes that, obesity. But after getting the loose skin removal, I felt like, okay, I'm finally where I can be. I'm just having a little bit of image issues of just like, what am I wearing? How do I look? Or does it look okay? Like, it's just, I lived with that loose skin for so long that I just kind of embraced, accepted it. Now that I don't have it, I'm like, it was like a real blanket for me. Now that I don't have it, I'm like, I feel weird. I love it and I love the results, but I just feel like I'm like another person. It's so weird.
Yeah. One thing that I've noticed is, personally for me, with the loose skin, is almost not a reminder, but it kind of scares me that, like, this might be temporary. Like, I might be able to gain it back and fill out that loose skin and become like that old person I was. It's kind of always in the back of my mind. Do you feel that, like, after you had the skin surgery, it became like, okay, no, this is me for real. Like, this is who I am and ready to start over.
Yes, exactly. I feel like I'm here. Like, I got here. This is where I was supposed to be, because, when you have that weight loss surgery, you're going to get loose skin, but you don't know how it's going to look until you're actually there and you get to your goal and you're like, whoa. And you don't know, like, until you're actually there. But when you have this, weight, when you remove this loose skin and you see yourself, you're just like, this is it. This is it. That's how it took me all these years to really be like, okay, this is it. This is it. This is you. This is what you envisioned the whole time. You just never got it because you just accepted it. Maybe I accepted it because I did seek a lot of therapy, and I would tell my therapist, I don't feel skinny. I know I've lost all this weight and people tell me, and I look at pictures, but I've been overweight my whole life. So I've had this image that I'm just so used to.
I refer to myself as, I'm a former fat girl. I always say that, or a former big back every time I say, because Because I still have sweets and stuff. Like, as a former big bag, I know. And everyone's just like, what? And I'm like, it's still in my head. Like, I feel like I'm always going to be a big girl that know how to eat and know how to cook.
Right.
So let's kind of go back to the early years when you first had it. Let's say the first 5 years after your surgery. What did that level of commitment look like compared to now?
I was 27 at the age, and that level of commitment was more, honestly, I'm going to be very transparent, honest. I took it for granted, and I was just like, I used the tool like it's a tool, like I can't really fit that much, so I'll never gain it. And I never gained it, just a little bit, but I still, had troubles because I never got to my goal weight and I had that stall. The 5 years was a journey. The first year was easy because I lost it all and I was able to get down to 180, and I was like, wow. And I remember I just struggled and struggled and struggled. I wanted to get to my goal weight for my height. I'm 5'5". I wanted to get to 140. So I didn't know what to do with myself. I went back to, the soup diet. I went back to the shake diet. I went back to the 3-day tuna diet. I went back to the old diets that I used to do. And I was like, hey, maybe those diets will work for me because I have a small stomach. But it was just still so hard.
Yeah, like didn't work before, but maybe now.
That like I still had that in me.
Yeah.
But what really helped is I tried everything. So one time I got with this fitness coach. I used to do a little bit of acting on the side. So I got with this fitness coach, and I was about to get married during that time. And they were looking for a bride that wanted to lose the last 30 pounds for her wedding. And that was me. So I got the call, and I was able to be casted in the show and work with the trainer to lose 30 pounds. And I was like, yes, this is going to help me because I have to do this. I'm going to be on TV, and I have to do this for people and for myself, and I'm going to get married and everything. So I did it, and I followed his direction, everything to a T. And it was hard. It was hard as if I still had my big stomach, but I did it to a T, and I got to my goal weight. And I came back on national TV, which is a doctor's, and I got my wedding dress, and I was so happy. Even though my loose skin was there, but I got to my goal weight, and that's when I finally got there. That's the first time that I experienced like, yes, I got there, and I was just so happy. Once I got there, I stood there for about a year, and then I struggled. I went back to 180. I always struggled mentally with food. If it wasn't food, it was an addiction to alcohol. If it wasn't alcohol, I'm gonna be very transparent. I had drug addiction. They say a lot of people that have food addictions can either go with food or drugs. That was me. And there it went back, and I started using drugs to go back to shrink, and just I struggled a lot. But I did get to that goal weight, and I did live a healthy lifestyle. And I remember the fitness coach telling me, when you do that, and I remember that stuck with me, and it's so true, because when you do that, it's not like you lose the weight, okay, and there, you celebrate, that's it. No, you really have to make this a healthy lifestyle. If not, you're going to go back. It has to be a healthy lifestyle. And I never got it. I was young, and I was like, oh, here and there. Now that I'm in my 40s, I'm there. It's a healthy lifestyle. And I dig that life. I'm there. I'm all in.
That's very true. And I'm really happy that you brought that up, because it's not discussed as much as it should, but transfer addiction is a very real and possible thing with this journey, because like you said, once you get rid of that food addiction, if you still have that addictive mind, you're just looking for something else to gorge on. If it's not food, it could be something else. Do you feel that going through this and going through like your lifestyle changes and everything, the mental is what was like the driving force to your success and really getting to that lifestyle change?
Absolutely. Yes. Absolutely.
How did you get there? I heard you mention therapy. Was that like the main factor, or just kind of getting to know yourself?
Yeah, I had therapy, and I would happen to already be in therapy for myself prior to that. So I'm glad I was in therapy, because just losing all this weight and finding my identity, like, oh my God, like I feel pretty. Oh my God, I'm pretty. I could dress this way. I'm getting attention. And even though I was engaged, just getting the attention and just embracing myself, just, it was hard to like cope with those feelings. So I'm glad that I was with the therapist at that time. She was able to help me and guide me and be like, look, you're feeling this way because this and that. You've been living this way your whole life. So this is all new to you and this is all okay. So that really helped me out a lot. And I did go to some support groups, but I just stopped going. But there was, support groups available as well. And that helped.
It's important to find your community.
Yes.
So I'm sure that like your instructions and everything when you got your surgery is a lot different than what we hear now. But like, what's one routine that you've done since surgery that you still do to this day?
One routine is, I didn't always stick with it when I first had it because we're not used to it. When you eat, you like to drink, so it goes down and it tastes better. And I never did that. I was like, oh, I hate doing that. I'm not going to wait 30 minutes. I'm thirsty. I'm not going to wait. But when I would do it, I've noticed I would get full and I would get full better instead of, because when I would do the water intake, it would just be water. And then I would get hungry really quick right away because it was just water. Because I felt like I had more water than actual food and protein that I'm supposed to have. So what I've learned is, okay, if I really follow the steps like it's supposed to, you're really supposed to eat the food and wait 30 minutes and then drink something, because then you allow yourself to have more food. And that's when, you want to, embrace the protein and the good stuff that you're supposed to, and then the drink. Because that's when you're able to, because we have a small stomach. So you have to have, as much protein and vitamins and nutrients as possible. So that sticks with me now to this day. I try to support that. And another thing I remember, when I was in the support group, there was this one therapist that said, and I always grew up, I always grew up in a household Hispanic. My mom always be like, you have to finish your food. You can't go out and play until you finish your food. And I always grew up like that. And I remember being in a support group, they're like, it's okay to waste food. Like if you can't finish it, it's okay. And me, I always grew up with never waste food. Don't ever throw away, ever. It's so bad. Like that's how I grew up. My family was my mom and dad grew up very poor. So that's how I was raised. And I remember what stuck with me the most when the therapist said, when you have food, you're either going to waste it. It's either going to go to waste or go to waste. Your waste,
I like that.
Always stuck with me.
Like that.
I know, and it always stuck with me. I was like, I'm wasting that shit. That shit ain't going to my waste. I'm wasting that shit.
Yeah.
Oh well,
it's not worth it.
yeah, it's not worth it. I've come too far,
That's very true. And one thing, going back to the water, one thing that I was not aware, because right after my surgery, when you're still healing, it's like physically impossible to really eat and drink. So you're kind of forced to slow down. But as you go through and you heal, you're able to drink and eat again. And I thought, well, as long as it's not uncomfortable, then that's fine. But that's not the only reason why they say that. They're saying that because, like you said, because of our little belly, if you're drinking and eating, it's almost like you're flushing all of the food through your stomach and you're not able to absorb any nutrients, and you're eating more and more than letting it sit there and let the stomach do what it needs to do with the food that you've already had.
Exactly.
That was something I thought it was more of like a comfortable thing, but it's also kind of like, no, that kind of helps with your intake as well, to wait until 30 minutes. It's still tough for me though.
It is.
I'm not gonna lie.
It is. I take little swigs here and there, but I've noticed when I don't, it helps, and it helps me feel full, and I'm like, okay. It helps. Even with
I try to don't have my cup near. If my cup is near, I find myself reaching for it. So I just don't even have it near the table.
That's a difference too.
Okay, so we talk a lot about the physical side of bariatric surgery, but what about the emotional? Let's dive into things like grieving food, finding identity beyond the meals, and the mental toll of the transformation. So my first question would be, what was it like to grieve food after surgery?
Oh man, it was pretty sad. I remember I had my surgery in like November, I want to say like 11th, right before Thanksgiving. Right before Thanksgiving. And I remember I had the puree stage, and it was
Same.
The puree stage during Thanksgiving, and I remember going through, and I was just so sad. I was like, I don't want to celebrate Thanksgiving. I want to go with my family. I don't want to do anything because I can't have food. So what's the point, you know? But I did, and it was just so sad. I had my little mashed potatoes because that's all I can have as a puree, and I enjoyed it. And just, I remember as far as, my identity, also going to like restaurants with people that didn't know, and they look at you, get these big portions and you barely even touch it, and they look at your food like that's all you're gonna eat, like that's all, and like to you feel like you ate a lot and you're fine, but to them they're like, are you okay?
And you're almost like guilty, like you feel like you ate too much sometimes.
And I feel like they're going to think I'm so weird because you're still in this image of this fat girl. They're like, come on, big girl. I feel like they're looking at me like, come on, big girl. Don't tell me you cannot eat that. Quit playing. Like you have this big food, like you're big. Like, come on, I know you can eat that, but you really can't because they have no idea that you have this like small stomach that you can't, you're taking all that food. It could probably last you for, the next day for breakfast and lunch.
Yeah.
Yeah.
And you don't want to be that person, because I will always hate to be around that skinny girl that can only eat I always didn't want to be that person, to be like that around people. So you feel kind of like socially awkward to now be that person, because you physically cannot eat it, and you're not trying to perpetrate, but it's like, if I eat any more, I am going to barf.
Yeah. Or there's been instances when, you go on dates, they're like, you don't have to be shy over me. I'm like, I'm not shy.
Trust me, I don't care. Exactly.
I just can't fit it. I won't be able to walk.
So thinking about like the hardest times when you're dealing with your body changing and dealing with the emotions and your like identity shift, how was that for you going through that transformation, but your mind itself hadn't really caught up yet?
The body dysmorphia was always there. I didn't even know what body dysmorphia was, honestly. And I didn't really engage into that term until recently this year. But I didn't know I've always had it from before. And how I would struggle with it is, like I said, I was overweight my whole life. And I remember I started taking pictures and being obsessed with myself and my looks, which is a good feeling, and I recommend everybody to do that when they lose weight, because you're like a new person. And it's okay to do that. I love seeing people's TikToks and their weight transfer and how happy. I love it because I remember being there. It's a great feeling, and I want everybody to embrace that and feel it. So with doing that, I remember looking in the mirror, I guess because of my loose belly, I'd be like, hey, I know I lost 100 pounds. And the only times I would be convinced is when I would see people and they'll be like, oh my God. Or when I would really have to see pictures, take pictures, obsessed with pictures and pictures and pictures, and see like, oh, wow. And then I would see another picture, I'd be like, oh, wow. And then see it before, like that would help me because I couldn't believe that. It was almost like an obsession I had.
Yeah.
And I always struggle with that. I still do to this day. I struggle with it even more now, especially after the loose skin removal. Like I still look at myself, I'm like, I can't believe it's there. And I still kind of rewind myself back. Like it's really gone. Like my body looks so weird, even though it's the way it's supposed to be. It just looks so weird. Like I'm like, I have a short waist, I have a short body, like I have a short this, like you could see everything. I still go through it to this day. It's still a journey within itself, with just, falling through and just maintaining. It's always a journey for me because like I said, I just have that, I'm addicted to food. I love food. If it's not food, I'm addicted to substance abuse. So I just have to, maintain myself by, doing things like this. Doing content of how I do it. That helps me. Looking at other, motivational speakers, looking at other people that, have gone through their journey that are fresh. So I just stay logged in and I stay inspired. That helps me.
How do you find new ways to comfort yourself outside of food?
I do the stuff that I love to do, like swim. I love to jog by the beach. I love dogs, walking them.
Did you think, or did you have to train yourself to not look to food when it was time for entertainment or something to do? Because I noticed like socially, a lot of things I was doing, even with like friends and family, revolved around food. So it's like I had to train myself to be like, okay, what else can I do outside of going out to eat?
Yeah, that's hard because that's what everybody does. Let's go somewhere. Where you want to go? Dinner? You want to go to the movies? Even if you go to the movies,
Yeah.
food, you have to have snacks, to all that. Like, so yeah, you
gotta have popcorn.
Yeah, you really. So I trained myself to do healthy things that get me active. That doesn't involve food. Like, call up a friend. Let's go to an amusement park. Let's go hiking. Let's go tan. Let's go lay out by the beach. Stuff like that. That's the only thing I can do, and just train myself. Like, it doesn't have to be celebrated with food. And if there is food, just really watch what I eat and not overindulge. I don't drink no more. I've been sober for 4 years, so that really helps me. And
Congratulations.
Thank you. And when I go to like meetings, that's also when I go to my AA meetings, that also is my support system. That's also one tool that I use, other than, dinner and stuff like that.
So you're still actively trying to maintain that mindset and that lifestyle, like you said, of just staying focused on you and centering yourself so you don't have anything. Yeah.
Yeah, my healthy lifestyle as well as my sobriety. It's very important for me.
That's beautiful.
I'm 44, I'm about to be 45, so it's like I'm not getting any younger. Things have to change.
How was that like going through skin surgery, having addictions? Did you do it cold turkey, or were you able to take pain meds?
Going through addiction, I did not do it cold turkey. I went to treatment. I struggled a lot off and on with it, as well as food, pretty much my whole life. The last straw, I was just done with, sick and tired of being sick and tired of myself. And I went to treatment. I got help because I knew there was help out there. I had gone to treatments before and I just never worked the program. When I was ready, really done and ready, that's what helped me, because I was really ready mentally. Just like when you're ready to have that surgery and you're done with being fat. That's exactly how I felt with, drugging and drinking. I felt ready. So I went to treatment, and I followed directions of treatment, and I continued it by obtaining a sponsor, working the program, and just sticking with it, taking care of myself by going to meetings every day, picking up a sponsor, helping people. And I can revert back to the way you eat, how we eat, when we lose weight, we have to maintain it by exercising, maintaining our weight by eating healthy. So that's how I maintain my sobriety as well. My sobriety as well as my healthy eating. I maintain it like that.
So what was that final push to make you say, okay, let's do the skin removal? I'm finally ready to do it.
I had been just doing so good. I'm 4 years sober, no alcohol, no nothing. I'm healthy, like fully healthy now. Like before, I was healthy, but I was still drinking and smoking pot and stuff, that wasn't really healthy. All really bad for you. And, throughout the 4-year process, I was about 180, and I was like, I want to get back to my 140 weight again. Here I go again. I could do it. I'm not drinking. I'm not doing drugs. I could do it. I have that power. So what helped me is I did Ozempic. That helped me big time to get to my goal weight. And once I got to my goal weight, my skin just started really bothering me. I was like, my skin on my stomach was like, and it started affecting my brain. I've been working so hard for 17 years, up and down, up and down. Like, I really started just thinking one day, like, I deserve this. Like, why don't you get the tummy tuck? Why are you scared? Just do it. And I'm like, the only thing that's stopping me is money.
That's a big factor.
Yeah. I'm like, get it. I'm going to get it. Like, who cares? I don't know where I'm going to get the money, but I'm going to get it. And one day I talked to my mom about it. I go, Mom, I hate my loose skin. I'm going to get the tummy tuck. I don't know when, but I'm going to get it. I'm just letting you know. My mom's also, she's a bariatric patient too. She got a tummy tuck like within the first year. And she would tell me, get it, get it. And I'd be like, no, I'm scared. I never got it. And I wish I did, but I didn't I was too scared. I was barely going through my whole transition of, there's no way I would have done that. That was too fast for me. So fast forward, my mom was like, why don't you look up some doctors and I would love you and I would like for you to be happy. And I got you. And that was just the best gift ever.
Oh my gosh.
And I would have never done it. I probably would have, but it would have took longer. And that was her gift.
Yeah.
Because she loves me and she wants
That
me
is
to be
so
happy.
sweet.
Yeah. And I'm just so grateful.
That is beautiful.
It is. And I just
Yeah.
couldn't thank her enough because I'm just so happy, you know? She's like, you got the rest. I got the bulk of it. And I'm like, yeah, I know, I understand.
That's beautiful. And I'm sure she saw your journey
did.
and you going through everything and healing. And I'm sure she's just as proud of you and where you are. So I'm sure it was a celebration for her just as much as it was for you.
Yeah, she wanted me to be happy because I don't live near her. I live like an hour away and I visit her every month. And when I saw her, she's like, oh my God, you're so skinny. Because, you know, Ozempic, like you lose weight fast. And I'm like,
Yeah.
I know. She's like, honey, you have so much skin. And I'd be like, Mom, like, shut up, you know? And not that she felt bad or for me, but she wanted to be on my all-time happiness, you know, with my weight loss. And like you said, like she saw the whole journey that I went through. I worked hard and everything. So that was just like the best thing that I could have done for myself.
And it's like, because she's already had this journey, she knew what the tummy tuck would do for you. And so I'm really glad that she was able to help you with that. Go mom. Love that.
I know. I know. Go mom. I know. I'll never, ever thank her enough. You never. I still thank her to this day. I'm like, Mom, I love you so much. I appreciate it. She knows, like,
That's so
you know.
sweet.
This episode may end here, but the journey doesn't. Parallel Paths is the Bariatric Paths membership for people who want continued support, real conversations, and connection beyond the podcast. If that sounds like what you need right now, go to www.bariatricpaths.com and see if the community feels like the next right step for you. Remember, your journey is yours, but you are not alone. Go out there and crush it. Bye.
This podcast is for support and inspiration only. It is not medical advice. Always talk to your doctor or care team about what's right for you.